Okay, I've got all the information right here. This is a national campaign. All the partners were carefully selected to represent all the good work being done from coast to coast. Isn't that wonderful? These are probably all decent people, but I can tell you, Canadians are not all nice. Not at all. This is a great list of all their accomplishments, but I'm going to tell you about my neighbor, Doug Chevrolet. He is not on this list, and he's about as Canadian as you get. I mean, he's a big fat mullet wearing, hockey watching, maple leaf drinking, female bacon eating son of a legionnaire. Man, you know, he killed my dog is what he did. Okay, I was looking everywhere. Okay, and he's out there hanging out with his friends in the garage, just watching a Leafs game, in their Muskoka chairs, and I happened upon them because I was, like I said, looking for my dog. Was gone. I was panicked. I walk up on Doug, and sure enough, there's Fluffy standing on the table with two brown marbles for eyes staring back at me. To stop my heart, Doug's he's running an illegal taxidermy operation out of his garage there. It's like a hobby sideline hustle business that he's doing and beating taxes and poking it to the man, if you know what I mean. And there's my dog, and he says that he just found him. He didn't kill him, he found him. Well, I know for a fact that he killed him, and it was extortion because what he tried to do then was sell me my dog, because he said it was his property now, even though his taxidermy business is unlicensed. It's ridiculous that I'm going to pay for my own dead dog that he stuffed and put marbles in its eyes. But I mean, I had to take him home. I mean, it's Fluffy. It's just, it was, so, you know, like, the Canadians are not all they're cracked up to be. Doug Chevrolet's a piece of, there's plenty wrong with Canada. These are great people. I'm not arguing with that. These partners are fantastic, and harm reduction is wonderful. Right? You got to get some, like, going on your time. But Canada is like, it's not like they say, okay, have a nice day, hey, how are you, Bob? It's not like that. Your neighbors will flush their gravity toilets in their fancy solar-powered mansions right into your little swamp area, even though it's your own private property, and you're going to live in your Canadian neighbors' mess. You know, it's not all bacon and eggs in the northern part of North America. It's, Canada's like a dysfunctional family. If you think about it, Toronto's like dad, he's too busy working to take care of his little provinces, Mom's Vancouver, she moved out west, she's seeing some dude named Seattle, right? Stepmom named Quebec, right? Ex-stripper, kind of a bitch, always threatening to leave. There's creepy Uncle Calgary. You just stay away from him. All the other kids are all the other provinces, and they're all grown up now, and they don't talk to each other, And Grandma and Grandpa are the territories. They're just old, and we ignore them, Canada. Oh, Canada. Right? GST and HST and, what is even happening? It's not, I'm happy to be here. I'm happy to be here. I did spend a week and a half in Guantanamo Bay. I was at an all-inclusive in Veradero, and there was a misunderstanding over rum. I was drunk on rum and gotten into a misunderstanding with somebody who didn't understand what I was saying. They thought I wanted to argue with them. I just wanted to have some more rum. And anyway, I woke up in Guantanamo Bay. I'm happy to be in Canada, but let's not pretend that it's something that it's not. That's all I'm saying. Like, let's keep it real, right? Kids, like, let's keep it, we're keeping it real here on the Telethon. All the time. Anyway, let's hear from the partners.
AIDS Committee Newfoundland and Labrador has a vision of working together to create a province without HIV, AIDS, and hepatitis C. AQPSUD is a provincial organization which, according to the harm reduction philosophy and an empowerment perspective, brings together drug users who aspire to promote health, prevent sexual transmitted and blood-borne infections, and improve their living conditions. Avenue B is reducing harm, inspiring change.
We have peer health navigators coming in and getting multiple supplies for people who are not on our list.
People are coming in the door and asking for a peer health navigator. People we've never seen before are coming in and asking for them by name.
To help people within PHN, is now they have someone to confide in, someone they could trust. Because there's so many people out there that are so quiet that need the help. They don't know who to trust, and trust is a big issue. If you don't have the trust, you got nothing.
People trust other people who are in the same boat they are. For instance, if I tell someone who's in a bad way with an abscess that they need medical attention, they might walk right out the door. But if a peer says, gee man, I saw a buddy with an infection like that and he lost his foot, let's go to the hospital and get it looked at. I've got a bus pass and we'll go together. That works.
Hey Jim, how was your walkabout?
Handed out quite a few things today.
Yeah.
You know, there's a lot of sick people out there, and there was one guy who actually had to call an ambulance for. Yeah, he wasn't doing good, not at all. And
Yeah.
but time goes so fast. Right?
I know, Jim.
Yeah.
I know. Away you go for next trip.
Okay. All right.
All right.
See you.
I find anybody can be a drug addict. You know what I mean? It affects anybody, all walks of life. Stereotyping people that can be very harmful. You've got to treat everybody as an individual and not as a group, because everybody has their own story.
By being there, when people want to get clean, we're there to help. We'll send you on the right path. There's going to be a lot of walls on that path, but you can walk around that wall or jump it.
The biggest change I see in the peer health navigators is just the sense of pride, the sense of value they have in themselves, and they're doing something good. These peers who thought they were coming with nothing actually bring all of the valuable experience they've had to the table.
People don't really understand the disease of addiction. it's such a bad disease, and it's just, I wish other people could realize what it is.
The peer health navigators' knowledge and connections that they've built won't go away. Even if we as an organization were gone, this knowledge will stay in the community and stay with these people.
The Peer Health Navigator Project, it's about nurturing and being in relationship. The whole hope is that we nurture and support those peer health navigators here, and then they'll go and do the same thing out on the street.
Through our needle distribution program, we recognize so many people who use substances just don't have any connections with other agencies or even other people. And sometimes people are living quite alone.
When I was using, people didn't look at me. They would look over me.
I started using because I wanted to fit in, and I had some not so good times coming into the teenage years, so it wasn't all that easy, and I found when I used certain things, I didn't have those feelings anymore, and I just wanted it all to go away.
We now encourage the peer health navigators is to be in relationship with people, to build those relationships in the community.
If you have a cut on your face, we have a Band-Aid for that. If you have an infection, we got gauze for that. If you need to go to the hospital, we'll go with you.
Being in PHN makes me feel really good and really sad, too. All in one. I know especially the females I know they don't want to be here.
I want to help the lost, lonely little girl that was like myself, who just needs a helping hand and a little bit of motivation behind her to help her show her worthy and get her come out of the dark shadow.
Avenue B is a community builder, and we've been doing it for a long time. We wanted to run a peer health navigator project to reach the most vulnerable and marginalized people living in the St. John area.
I can't tell them, hey, I was there, I had a pill addiction, alcohol addiction also, and I went to Ridgewood. I was the youngest one there when I first went, and I was doing high school work, my homework, and I was so scared, but I had to do it.
We've been very aware for years that we need to have more of a presence on the street, and that the best people to help people who are, virtually operating on the street are other people that have been on the street. When peers talk to peers, we know that works.
It's like I have a sixth sense. I can spot people who they are and what they are. I know what it's like to be on the street and don't have nothing. You can feel the pain.
PHNs did training in sexually transmitted disease, naloxone training, hepatitis C and HIV, how they're transmitted. The PHNs, I think all except one, are people that we've known for 5 to 10 years. They believe in what we're saying, and therefore they trust us and the information that we're giving them. The peer health navigators gain confidence in themselves because of that education and information that's been provided to them in preparation for going out on the street.
I learned to go out as a PHN because they train you so that you know and you're very comfortable knowing what you have to do.
I wanted to be a PHN because I've been there and I know what it's like to relate, and I can relate to them easier than somebody who hasn't done a drug in their life ever. And it's hard to relate to people like myself if you don't know how they really feel.
I like to work with other addicts and alcoholics. I think we could help each other.
When I put on the vest, it makes me feel proud of myself. It puts pep in my step. I feel 10 feet tall and bulletproof.
When I come in and grab a backpack and wear it out the door, this just makes me feel like whoever helped them today. Like, who's next?
We're a team first and foremost. If we're not a team, we can't do this work. And that's what we've been missing, is that peer part of the team.
The Ally Center creates supportive environments to reduce harm and promote health. Blood Ties Forward Direction Center's mission is to eliminate barriers and create opportunities for people to have equal access to health and wellness and to live in their community with dignity. The AIDS Network Harm Reduction Outreach Program reaches out to people who use drugs to increase knowledge and awareness of harm reduction practices and to increase access to community services. In Inuktitut, Kamatsiaqtut means thoughtful people who care. Their trained volunteers are on the phone 24 hours a day, every day of the week. The Manitoba Harm Reduction Network works toward equitable access, systemic change, and reducing the transmission of sexually transmitted and blood-borne infections through advocacy, policy work, education, research, and relationships. Moms Stop the Harm is a network of Canadian families impacted by substance use-related harms and deaths. They advocate to change failed drug policies and provide peer support to grieving families and those with loved ones who use or have used substances.
Sirens are a trigger for me. Ambulances, fire trucks, police, and there are a lot of sirens in a city.
A dramatic increase in opioid deaths.
In BC alone, more than 100 people die every month.
Deaths from fentanyl spike in Alberta.
He died April 30th, 2014. I found him in his apartment. That's kind of the day that changed everything. He liked to play guitar, and he wrote lyrics to songs. I have his guitar here. Danny was the youngest, and with his siblings being more academically inclined, Danny struggled a bit in school. I think he was almost 16 when he came out as gay. When he came out, it was totally okay for us, like as a family. But I later learned that Danny faced some bullying in school. I think he started to self-medicate with substances.
Have you ever been there before with the Yellowhead Brewery?
Not with the Yellowhead Brewery, but I've been there.
As a parent whose child is using, especially opioids, especially intravenously, you're always afraid that one day he will get bad news. And I knocked on the door, I said his name, Danny? Danny, are you in there? There wasn't a sound coming from that bathroom. And I thought, wow, this could be it. This could be the day where I get that news. And I opened the door and he was laying on the floor in the bathroom. It's sort of an image that's burnt in your mind.
It's almost inconceivable that this many people have died without radical change. Since 2014, when my son died, that's when I started looking at the numbers. There have been over 15,000 deaths from drug harms, and mostly from overdose.
Illicit drug overdoses have claimed the lives of 526 British Columbians.
The ripple effect of 15,000 deaths in our culture, in our small country of Canada, in our small population, it's actually immeasurable. Jordan just came right out and said, I'm addicted to Oxy. The doctor yelled at him and said, how did you do this? Why did you become addicted? And then he said, you know, if an addict's lips are moving, he's lying. We got a phone call in the evening that he had passed away in his apartment by himself, having taken these several drugs. It was hydromorphone, and it was Xanax, and it was an antidepressant. I yelled the word no over about 1,000 times that night because I just wanted it to not be that way.
So in January 2015, this young journalist, Otiena Olivard, she did a beautiful, beautiful spread about Danny. The day the story was published, that was the first time where I felt my heart was a little like I could handle that grief.
My old dad, old school, sent me a newspaper clipping through the mail, and it was a story of a woman in Edmonton, a family in Edmonton who had similarly lost their son. It was now my friend Petra Schultz, and she and her husband Rick had lost Danny, who was the same age as Jordan, 25 years old when he died.
A year later is when we formally put together Mum Stop the Harm.
Hello, here from Lethbridge, Mum Stop the Harm.
Stop the harm! Stop the harm!
According to my son.
I guess the beginning part of 2016, we had found a name and a website and a mission, and it's been an upward rate ever since then.
The numbers that we have joining our group every day are astounding.
We always say it's the good news and the bad news when people join. We're glad when people in need of support and in need of information join us, but we also see every day the stories of loss.
Every conversation is an opportunity for change. We need to be outspoken, share our stories. We can't keep it in like a small drug policy bubble.
Not one more! Not one more!
When a person tells their story, you see how they have been affected. You see the emotion. There is really power in stories, and stories are transformative.
Families can't find resources that are humane and that are evidence-based. The frustrating thing is that we have the evidence. We know how to solve the problem. We know that people need support. People need housing. People may need medically assisted treatment if they want to get off the drugs. We just don't have the will, and stigma is at the bottom of it.
For us in Mum Stop the Harm, the power is that we don't make it the them and us. It's not our kids versus their kids. It's everybody's kids, everybody's loved one. Some parents have almost like a bit of shrine to that child. We realized that our kids hadn't died because they were bad people or because we were bad parents. They had died because we had bad drug policies, and we all felt strongly we had to change that.
Many people think they can't survive the death of a child. And I get joked at because I didn't think I was going to survive it. So part of what we do every day or tomorrow is to say you will survive and stick with us, and we'll hold you.
We're going to be making a second dish. What are we making then?
It's a potato salad. My family's actually German. It's my mother's potato salad recipe, and it's.
We told Danny's truth, but we told it too late. And don't let the truth be too late for somebody you love.
Prairie Harm Reduction's mission is to improve the quality of life for all members of their community through gold standards in harm reduction, emphasizing local action with national impact.
We're sitting in Saskatchewan's first safe consumption site. What a safe consumption site is it's basically a facility where people who use drugs can use drugs safely and under the observations of a medical professional. More and more we're seeing drug supply becoming more and more toxic. It's being laced with things like fentanyl, and as a result people are dying, and we're starting to see record numbers of overdoses in the community. We've been working towards this site for about 5 years, and here we are, we're in the midst of an overdose epidemic, an HIV epidemic, and we have the consumption site ready to go.
We currently have very, very high rates of overdose deaths and really high rates of HIV and people living with complications of HIV. So safe consumption sites have been shown to reduce new infection rates in the communities where they exist.
People who inject drugs are costing the healthcare system over $3 million a year in Saskatoon alone. Not to mention that once again we led the country in HIV infections, which each of those infections cost $1.3 million over the course of their lifetime. What we're trying to do is to get them to bring drugs into our facilities so that they're no longer using them in full view of members of the public and improperly discarding their needles. And a big thing that's happening right now is when somebody overdoses in public, first responders have to respond, which is costing the system a lot of money, but it's also costing EMS, fire and police services a lot of time. We want to make sure that they're able to go respond to calls that are more suited to their skill set, when we can actually take a lot of those emergency calls for overdoses and bring them into our building, and our staff can handle it, and then somebody doesn't have to go to hospital and eat up that hospital bed.
Prairie Harm Reduction has a really crucial role to play in Saskatoon, both through their outreach programs and supervised or safe consumption. As they fill that need, we see people coming down to a point where they're more stable, and with stability comes behavior that doesn't require police intervention. And so we see them as an excellent partner in that regard.
It's been part of our commitment to work with the Saskatoon Police Service on opening this site. The 50-meter radius around our building was one of the highest crime rates in the entire city, and they've been at historic lows. That's not an accident. That's because we provide people a place that they respect, and they feel like they're a part of this community and they're integrated into this community.
I grew up learning how to cook in Vancouver, so I am used to seeing restaurants right next to safe injection sites, right next to food banks. I'm just really happy to have them as a resource so close, because I think they're actually right where they need to be, and this is a really beautiful community that kind of all bands together, so I think having them as a part of that is going to help move all of us forward and create a safer space for everyone.
The people who access services here, most of them, the majority of them, have been told their whole lives that they're not worth anything. And when people are living that life and hearing those things for so long, they really don't see a value in themselves. What we've seen for years running a drop-in center is if we just create a space where people want to be, then they start to talk to staff and they start to ask questions and they start to ask for help. And that process for a lot of the folks that come through our doors happens pretty quickly.
Once people come in, yes, they use their drugs in this facility, but a lot of sites across Canada, they don't have the benefit of what we have, which is $1 million operation on the other side of this site, which is all of our outreach services. It's not just about using drugs in the facility, it's about connecting them and getting them down that healing journey. We want to show that impact and we want to measure it in real time. Every dollar invested in a consumption site is shown to save $2 on return. And if we want to achieve these long-term outcomes with folks, we have to keep them alive. It's really a life or death matter for our clientele. The other is we're going to be reducing crime rates in the neighborhood, we're going to be reducing needles in the city, and we're going to be increasing those connections that people can have so that they can go down that path to recovery and be successful in the long term.
SUNAR is a peer-led regional network of people with lived and living experience of substance use across Atlantic Canada.
Hi there everyone, my name is Mateo Ferguson.
My name is Brian McDonald.
My name is Lois Jackson.
My name is Catherine Shanks.
My name is Tommy Brothers.
My name is Gregory Keynes.
My name is Jules.
My name is Diane.
My name is Julian Correct.
My name is Johnny Ehrenberg.
Hi, my name is Scott.
My name is Lydia Cameron.
And I'm Holly McDonald.
I am a registered nurse.
I've been working in harm reduction for the past 15 years.
I moved to Halifax when I was 18 years old to get on the methadone program.
I have 3 kids, 2 boys and a girl. I got on methadone when I was 6.5 months pregnant with my daughter.
My oldest son has struggled with substance use.
I started using drugs at a young age. I'm paying for it now, psychologically and physically.
International Overdose Awareness Day is August 31st. This is a day when we can raise awareness about overdoses, as well as acknowledge all of the lives that we have lost to an overdose.
It allows us to stop and think for a second about the parents that have already buried their children. That's my worst nightmare.
I cannot tell you how many folks have come through our doors and have left never to return.
We've lost too many.
I've had about 4 friends pass away, close friends, in the last year.
You know, I've almost lost my life multiple times. I have a daughter that almost lost her father due to addiction.
I can't even keep count how many friends and how many peers have died because of an overdose.
I lost my brother due to an overdose. It's not a good feeling at all.
Overdoses are preventable.
Our overdose death crisis is the product of criminalizing drugs and criminalizing and stigmatizing people who use drugs.
It affects our homes, it affects our communities, it affects our loved ones, it affects how we go about our lives every day.
One overdose is one overdose too many.
I support the overdose prevention site and I support Safe Supply because it saves people's lives.
We need to increase access to safe injection and safe inhalation sites, and we need to improve access and quality of addiction treatment care for people who want it.
So the only thing that worked for me was getting methadone every day.
I like to see places like this because it'll stop the deaths.
Overdose Awareness Day for me means to get the proper info out.
I just think it's very important to have that out there, that there is a place to go and there's people to ask for help.
In some way or shape or form, we are all struggling. And instead of demonizing folks for their addiction, we should seek to help them.
People that use drugs are not pieces of garbage, you know, they're people.
I think humans need to be treated like humans.
So for me, International Overdose Awareness Day is not only about raising awareness, it's also about creating change.
I hope you will join us. I hope to see you. I hope you educate yourself and become a part of this beautiful change.
Turning Point provides a selection of harm reduction tools that, when safely used, will prevent the transmission of HIV, hepatitis C, and other blood-borne pathogens. Toronto Indigenous harm reduction emerged during the first wave of the COVID-19 pandemic in response to a massive shutdown of frontline services and a lack of basic needs for Indigenous houseless folks in the city of Toronto. The Yellowknife Women's Society is a grassroots, community-based charitable organization. The goal of this society is to support and assist women in empowering themselves so they can develop their goals, achieve wellness, enjoy equality, and be recognized for the contribution they make to the community.
Hello, good morning. My name is Diana Levanta. I am a social worker and I currently work with the Yellowknife Women's Society. It is a great pleasure and honor for me to speak to you today a little bit about the Women's Society and what the Women's Society is all about. Now, personally, I joined the society in early 2019. When I joined the society, I started off as a service coordinator with the Yellowknife Housing First program. And eventually I moved on to manage the rapid rehousing. And last year, my boss asked me if I could manage the Spruce Bowl shelter, which is the COVID isolation shelter. Now, before I speak to you more in details about what the Spruce Bowl isolation shelter is all about, please accord me a few minutes to speak to you about the Yellowknife Women's Society. The society was founded in 1990 with the main objective of empowering women to become equal contributing members of society. That is to say, a society cannot evolve without the participation and contribution of women. So it is important that as a society or as a community, we empower women to be able to speak up, get that voice of change out there. And fortunately, since its foundation, the society hasn't been static. What I mean by that is, over the years, it has expanded. It has added programs such as the Yellowknife Women's Shelter, the Housing First Program, Rapid Rehousing Program, Common Ground, and as well as the Outreach Program. And as I mentioned earlier, most recently they added the Spruce Bowl Shelter, which is the COVID Isolation Shelter. Now, the COVID Isolation Shelter was founded during the heart of the COVID pandemic. And most often people ask, what's our mission and objective of this shelter? Well, the mission is for us to provide safe places or safe space for individuals, the most vulnerable population, to safely isolate and to safely isolate and save us lives. What I mean by that is, given the fact that most of the clients here are very vulnerable with their health, in case if any of them were to be exposed to the COVID virus, they will have little to no chances of survival. So hence we have this shelter where we provide safe space for them, hopefully for another day or so. And now the shelter was built with the main objective of protecting people, providing a space for people to isolate. However, we also go an extra mile to have them understand that it's never too late to regain your place in society. I know most of them have been beat down due to intergenerational traumas, due to residential schools, just to name a few. They've been beat down so much, and as a result, and over the years, they've lost a lot of self-confidence, a lot of self-worth. So that's part of the work we do here, is to restore the self-worth and confidence that they've lost, so they can become equal contributing members of society. And one thing that we offer here, which is very important, is the harm reduction program. Harm reduction program is very essential to the work we do, in the sense that we get to prevent a lot of health hazards, a lot of health people from going into health distress, such as having seizures or withdrawals due to alcohol, or due to too much use of alcohol over the years. So we provide them alcohol or substances in episodes of every 2 hours, depending, and it's not one fit all. It's everybody. It's tailored to everybody's need, right? So one person could be getting an ounce or 1.5 ounce every 2 hours. Another could be getting 3 ounces every 2 hours, all depending on their needs or where they are at in their journey of recovery, right? And so in essence, what I'm trying to say is, harm reduction does save lives. Not only does it help stabilize an individual through the day, it also helps maintain their mental health, because they are not always chasing for that fix, where am I going to find the next fix? As providing them with the substances that they deserve or they need gives them an opportunity to be able to explore other aspects of their lives. For instance, we have clients here, when they got in, all they wanted was to drink and get drunk. Now, a year later, we've seen clients who are actually requesting for things, or things like going back to school or wanting to get employment. And we do have a few clients here who are actually working, which is an amazing change if you would ask me. Once again, my name is Diana Lubanza, and I thank you very much for this opportunity.
Yellowknife Street Outreach provides safe rides for individuals who may be intoxicated or otherwise in need of assistance.
Hi, my name is Rachel. I am the program coordinator for Street Outreach. Street Outreach originated to address the high number of calls made to the RCMP, municipal enforcement, and also emergency medical services. Street Outreach operates from 12 p.m. to 12 midnight, 7 days a week. Street Outreach staff and volunteer are here to assist individuals who are vulnerable against homelessness, intoxication, as well as cognitive or physical disability. We provide basic needs such as water, snacks, and first aid. We offer individuals safe rides to safe locations such as shelters, their own home, and health providers. In addition, we work from a harm reduction approach. This includes giving out safe crack kits. We also conduct street patrols in the downtown area. This includes walking in the Frame Lake trails and the downtown mall to build rapport for our service users. In all of this, our goal is to promote safety and confidence in the well-being of our service users as well as the general public. Thank you.
I need money, all that money, all the money that I'm owed. Give me money, all that money. It's the color of green and gold. I'll be leaving town tonight. I hope you do what's right and put that goddamn money in my sight. Your story's getting old. Do what you have been told and pay me all that money that I'm owed. You like talking, you should be walking to my money where you got it stowed. I've come knocking, I'll start rocking if I feel like I'm getting bold. I'll be leaving town tonight. I hope you do what's right and put that goddamn money in my sight. Your story's getting old. Do what you have been told and pay me all that money that I know. Ooh, you don't even wanna get on my bad side. You're on my bad side now. Bad side. You're money? Where's my money? I'm done with talking and breaking bread. Pay me my money. Give me my money. I'm taking money. Oh, your head. I'll be leaving town tonight. I hope you do what's right and put that goddamn money in my sight. Your story's getting old. Just do what you have been told.